And Melissa, okay, we're recording, okay. And Christian, if you want to take the slide to the present mode.
Okay, is it not in that mode yet?
For me, I see it as a, so just in the edit, in the kind of the edit feature of PowerPoint. You'll see enable editing on the top there.
That's not what's on my screen. Sorry. Let me go out of full screen and see if I can start the slideshow from the beginning. Okay, it should be on from beginning.
I think you have to enable edit first. Because right now it's on a protected view, so it won't do anything.
Okay, all right. Okay, so sorry.
That's okay. If you want to stop sharing and
oh, I see. Enable editing.
Yeah.
I see it. I just got to get to that. Okay.
There you go.
There we go. How's that? Is that better?
Perfect.
Okay. Excellent. Well, I think we're ready to roll.
Okay. And good afternoon all. I have an interesting technical issue that just happened. I've completely lost my monitor, but I hear that you all can still see me, so that's good. I'm going to ask Nick Romo to step in to read a slide or two since I cannot see the screen right now, and I will troubleshoot this once I get through the introduction. So good afternoon all. It's good seeing you today and glad to have you being able to participate here with us. So today's webinar is really about more follow-up with our work with Department of Finance. And first, I want to thank you everyone who joined today, and additionally to the Department of Finance for partnering with the League on several webinars related to the CARES Act. So today we want to bring you all the most pertinent information to ensure successful Cycle 2 reporting regarding the CARES Act dollars that your cities have received. Cities have overwhelmingly demonstrated their need and use of the CARES Act funding to address COVID-19. And we look forward to continue to demonstrate to this, we look forward to continuing to demonstrate to the state and federal government that cities are essential to the COVID-19 response and recovery. So let's get to some housekeeping and to our speakers today. For housekeeping, please make sure your audio is connected. You should have been prompted to connect your audio when joining the webinar, but you can confirm by clicking the audio settings on your toolbar. As you may have noticed, we have muted the phone lines of all participants. We will have opportunity for live questions throughout the presentation. This webinar is being recorded, and a link to the recording, along with the PowerPoint slides, will be publicly distributed following today's event. For the next slide, Nick, can I please get you to read about how to ask a question?
Yeah, absolutely. Good afternoon, everybody. Nick Romo, advocate for revenue and taxation with the League of Cities. To writing a question, select the Q&A button on your toolbar. You can also upvote. That's very much appreciated. If someone has asked your same question, go ahead and upvote those questions, and this will help us to prioritize getting those questions answered during the Q&A portions of the presentation. All right, next slide.
Great, thanks, Nick. So for our speakers, I would like to introduce today and welcome back to this trio that has been with us throughout the past few months. Kristen Shelton. Kristen is the Chief of the Department of Finance Research and Analysis Unit and is responsible for tracking federal COVID-19 funding allocated to California. No small job for her, and we appreciate everything she is doing to help us get information out to cities. We also want to welcome back Audrey Bezos. Audrey is a principal budget program analyst with the department and has been a tremendous support to cities throughout this process. Also, I'd like to thank JC Thompson for joining us today. JC is also a principal program budget analyst with the department that has been instrumental to this project. So we will have questions and answers throughout this slide, and we'll have additional questions and answer discussion following the presentation. Kristen, I will hand it over to you.
Thank you so much, Melanie. And I'm happy to be back again to talk a little bit about Cycle 2 reporting, as well as to provide a recap related to cycle 1. I will say that both Audrey and JC are my wingmen. And without them, we probably wouldn't have gotten through, or I wouldn't have gotten through for sure, this last reporting cycle. We've been very, very busy since the last presentation, as well as reporting, including making changes to the portal. So working with IT folks to redesign and meet the federal reporting requirements through the data gathered in our portal, to post and publish all of the information that was gathered from cities, counties, and about 2,500 other recipients of coronavirus relief funds, and among many other tasks. So today I'm going to cover some of the requirements of the CARES Act, obviously focusing on new things, but I will talk just very briefly about the limitations and flexibilities. We'll talk a little bit about the remaining allocation process, which I'm assuming is of interest to all of the folks that have joined us today. We'll talk about the extension and return of funds that was outlined in the control section that governs the expenditure of coronavirus relief funds from a state perspective. I will also talk about reporting for cycle 2. We'll spend a little bit of time talking about user-defined categories and some of the common errors that we saw, as well as some updates to our FAQs and federal FAQ updates. And then we'll talk very briefly about subrecipient monitoring that will be happening in the coming months. So first, there were a number of just threshold requirements related to COVID and the CARES Act funds. Predominantly, and you'll see this in both our slides as well as in response to questions that we field, which is that the expenditures have to be necessary due to the COVID public health emergency, not accounted for in prior budgets, and then for costs that are incurred between March 1st, 2020 and December 30th, 2020. The funds cannot be used to backfill lost revenue, and it can't be used to just pay for staff that aren't considered or viewed substantially dedicated. And there are a few items that are disallowed per federal guidance. The CARES Act does have some flexibilities, the most notable of which is the ability to use the coronavirus relief funds as a match for FEMA funds. Typically, you cannot use federal funds to match federal funds, but the coronavirus relief funds may be used as a match so long as the activity is eligible under both, so both FEMA and both coronavirus relief funds guidance. The coronavirus relief funds definitely have a few more things that are eligible than the FEMA program does. Individuals that are defined as public health and public safety are presumed to be substantially dedicated, and recent guidance on the 21st of September kind of re-clarified what kinds of documentation is needed, as well as how they will go about reviewing and auditing in terms of the record keeping related to those staff that are public health and public safety. In early guidance, but after I think the last presentation I did, they have now, the federal government has now provided an actual definition for public health and public safety. It includes police officers, sheriffs and deputy sheriffs, firefighters and other emergency medical responders. So I think about paramedics and emergency medical transportation or technicians, EMTs. They also include correction and detentional offices, and then those individuals that provide either direct support to those public safety staff or managing or supervising those public safety staff. So for instance, dispatchers. For public health, they've also provided a broader definition of that. So it includes your typical public health department employees engaged in public health matters. This can include testing, contact tracing, epidemiology, surveillance, those types of things that are really common in the public health space. It also could include employees providing medical or other health services to patients, such as a community clinic. Medical staff assigned to schools, prisons, and other such institutions can also be covered or are part of the definition of public health, as well as what we would view as supportive services essential to patient care. The best example there is laboratory technicians. Finally, similar to public safety, those supervisors of these above employees are also eligible for reimbursement using the coronavirus relief funds. As we talked about before, administrative convenience was one of the terms that was used by the federal U.S. Treasury related to being able to use these funds to support public health and public safety. Unlike what was happening early in the guidance, this has now been clarified to be really specific about what kinds of documentation is needed. And there is no longer any hint or suggestion that documentation about what they are doing or the work that they are performing is necessary for any of those public health or public safety staff that I noted on the previous slides. Just being in one of those types of jobs or duties, the only documentation that's needed is actual payroll and benefit costs. And they've also defined benefit costs. It includes your typical benefits, your salary-driven taxes, as well as pension costs. And those can all be paid by CRF, but you must keep those payroll records, and that record retention timeframe is 5 years. The CARES Act does not allow backfill of lost revenue. However, when they think about, or when they've guided us on this administrative convenience, they believe that having public health or public safety staff be presumptively eligible for using coronavirus relief funds, that it really has through an indirect path helps offset lower receipts or lower revenues. And it also frees up potentially general purpose funds or general funds that can be used for other areas or priorities that might be in your locality. I want to talk just very briefly about the remaining allocations. So as you'll recall, at the outset, we were dispersing 1/6 of the funds each month. But we are preparing to do the final disbursement. So to date, half of the CRF that was available to each city has been dispersed. These are the disbursement dates. So if you aren't tracking or haven't found it, these are the dates by which you can go back and kind of look for the remittance to your locality from the state controller's office. In terms of our final allocation and process, we've shared previously that after the initial reporting that gives us the data and information we need to be sure that all of the funds will be spent as they have been allocated for a COVID eligible activity, we will be issuing our final payment or the balance of the payments related to coronavirus relief funds. This process, as it has each month, kicks off with finance receiving input from the Department of Public Health and the Office of Emergency Services, or CalOES. That data will help us do the verification of compliance with the public health orders. The state will issue our claim schedule to the controllers by October 7th. That will distribute $650 million to counties and $250 million to cities. There were a small number of cities that received a supplemental survey from the Department of Finance, as well as a few that received letters related to their spending plan for coronavirus relief funds. That survey will not in any way affect the payment schedule for coronavirus relief funds. In some instances, there was supplemental information required, and we will adjust if need be the final disbursement if no report was received. So for instance, if a city, and there were about 7 that did not report to the Department of Finance by the deadline or respond to any of our subsequent requests for information, if we don't have that information, we will not send out a final allocation. We will work to contact or coordinate with that particular city to figure out what our next steps are. We also had a couple of entities report projected expenditures through December 30th that were below the allocation amount that the state provided or had set aside for that entity. If we did not receive supplemental information that clarifies that they will in fact all be able to spend the full amount of funding, we will reduce that final allocation down to the level that was reported to Department of Finance. All of this is really going to the idea and our broad commitment, which is we want to keep the state coronavirus relief funds in the state. We don't want to have to return those funds to the U.S. Treasury, which we do have to do by December 30th. If, for instance, the funds aren't fully, expenses aren't incurred or goods aren't received or an obligation isn't booked against those funds, we will have to return them. There is the flexibility that was added to allow for a reasonable liquidation period. Generally, the Treasury has said that they expect most funds will not have a liquidation period beyond 90 days, though there may be certain circumstances where that makes sense, particularly as we think about governmental accounting practices. The certification that each city and county signed at the beginning of this process, so that happened early in July, requires that unspent funds of the state-directed CRF, coronavirus relief funds, are returned to the state by October 30th, unless the Department of Finance grants an extension. We will continue to gather the information through this cycle 2 reporting process, through supplemental reporting in certain instances where we've already done some outreach to you. And then we will be making those decisions no later than October 23rd. So every city should get some sort of communication from the Department of Finance to let them know if they've been approved for the funds to be extended or if they need to return some portion of those funds ultimately for us to reallocate them. So for cycle 2 reporting, we're going to be focusing on correcting some of the technical errors that we saw in the first cycle. There will be some adjustments to prior cycles as the reporting is cumulative. This second cycle will be focusing on expenditures from July 1st, 2020 through September 30th, 2020. And then we've made a slight change in our broader database to reflect remaining obligations in a single lump sum, not detailed in 17 or more categories. So first, we have already heard from a number of entities that the person that filed the initial report is either no longer working for that organization or is no longer responsible for reporting purposes. So because the report is linked to the email address of the individual or the email address used for the first cycle, if we need to change that person to a different person, we're asking that you register a new user first in the portal, and that can be done even though you can't enter data today. That can still be done in the portal, you just can't go beyond that step. Then we ask that you contact Department of Finance so that we can migrate cycle 1 data from an old email address to a new email address based on that process, that registration process, which would need to occur first. So our programmers have a script that will be run, but we need to have both email addresses in our system before we can make that change. The user guide 2.0 that we released today and published or posted on our Department of Finance website has additional information about how to complete this process or for you to refer back to, so you don't need to worry about taking notes. If you want to have access to the portal tomorrow, then this must be completed today. We will have a very short outage of the system, so that will also limit the ability to register during a short window of time today as we cut over from the old database to a new data structure to support second cycle reporting. As I mentioned, the portal is going to go live on October 6th, which is tomorrow, and the cycle 2 reports are due October 12th. We have a wide variety of information, COVID-19 information, obviously with a fiscal focus, on our Department of Finance website. So here's a screenshot of where you can find it. It's on our main landing page at www.dof.ca.gov. Within that area, you will come to a couple different options within that page. So one of them is a page dedicated to Coronavirus Relief Fund federal reporting. On that page, you will see the link go live again to the portal. Right now it's still closed, but that will go live tomorrow. You will see the latest and greatest user guide with an update of today. You will also see updated frequently asked questions, also updated today. And you'll see the due dates or the timeline that we're following for both this cycle of reporting as well as subsequent cycles. As part of this reporting process, we are hoping to correct a number of technical errors that were identified. Through the first cycle, we validated or attempted to validate all of the DUNS numbers that were provided to us. Some of them were rejected through the Grant Solutions portal. What that means is there was some sort of error related to the DUNS number that has to be corrected. Without a correct and valid DUNS number, you would need to provide the username, the address, and other information on our web portal. And Audrey will show you a little bit more about that today when she does her demo. The project IDs that should be used for cities is 10200. We had a couple where the project ID was incorrect, and we attempted to fix all of those for purposes of broader reporting, so please don't change that information. We also noticed that a number of entities entered the incorrect transfer type or transfer date related to the coronavirus relief funds. So all of the state-directed coronavirus relief funds are advanced transfers. That means that even though some of the expenditures could have occurred in a prior period before that first transfer on July 31st, they are still all viewed as advanced transfers. We have not set up a process where somebody reports to us their expenditures, we validate they're eligible, and then provide reimbursement on the back end. So even though it may feel that way a little bit, these are all still viewed as advanced transfers for federal reporting purposes. The transfer date is universal for all cities, and it's essentially the first date of transfer during that reporting window, which is July 31st, 2020. We are going to ask all of our users to help us correct some of the technical errors. One error that we know needs to be adjusted is the removing of unused user-defined categories. This includes any categories where you're going to zero out an adjustment and move the dollars up to one of the A through Q categories as predefined by the federal government. We're going to ask everybody to recheck and re-verify their allocation amount. Those allocation amounts are found on the Department of Finance website, and it's under the Coronavirus Relief Fund allocations to cities and counties, which can be found off that main COVID-19 page. We had a number of entities that might have been off by at least $1 or were rounded based on information and data in the system. We did notify all of the people that were over the total allocation available, but we may not have identified an incorrect allocation amount for those that were under the federal level. So please re-verify and re-enter your allocation amount based on the information on the Department of Finance website. We have also taken out the ability to add cents. So we did a rounding routine, which could also cause a small rounding issue. So you want to revisit and make sure that before you certify and submit, that once those dollars are rounded, it does not end up exceeding the coronavirus relief allocation amounts. And then our zip code field, based on information from the Treasury on their reporting portal, zip code field is now your zip +4. So if that information, if you entered your information in lieu of a DUNS number, go back and add those extra 4 digits for the zip code fields because they will only show the first 5. In terms of our approach to how we are handling obligations in the web portal as redesigned, we are combining those obligations into a single lump sum on the reporting screen. As a reminder, obligations are commitment of funds outlined in an agreement, such as a contract or a grant. Could also include purchase orders or requisitions related to a good or service, either incurred or purchase requisition has gone forward. So those would show up as an obligation or be considered as part of your obligation amount. The OIG, as I mentioned, is not collecting category details on obligations. They only want that information when it's been liquidated or expended based on their definition. And so we wanted to simplify our portal as well. All of the obligations will be based on obligations that remain as of 9/30/20 and that's going to be found on the top right-hand side of the Part C screen that Audrey will demonstrate for you in a few minutes. I mentioned the change in the reporting schedule. So when we embarked on our federal reporting process using their portal, it became very quickly evident that providing the level of details that they asked for more than 3,000 subrecipients was very labor intensive. So us, along with a number of other prime recipients, many of which were states as well, noted that labor intensive process, asked for an upload template or option. And California is one of the states that was approved for this upload process based on our response to one of their surveys. So California, along with 35 other prime recipients, which is a combination of states and county governments or possibly even city governments. So no data at this time is being reported to the OIG based on the previously reported schedule. So we have a slightly different reporting schedule. However, given the political sensitivity of not reporting any expenditures when we know that we've had incurred vast costs, and that we know that even the funds that have been provided are not sufficient to meet the response cost at the state and local level, government level, we are still publishing on our website the full detail as if we were reporting to the federal government. So we have a web portal that's equivalent where we're posting our data, and we're sticking to the OIG kind of where they hand off to the PRAC, or the Pandemic Response Accountability Committee. So after cycle 2 reporting, we will post once again on our website the data that's reported to us from each of our subrecipients on the 21st of October. Our first formal report to the federal government, covering what would have been cycle 1 and cycle 2, will cover a 7-month period of March 1st through September 30th. And we will be submitting that information to the federal treasury by the 15th of December. And then that information will be posted on the 24th of December, both to our website as well as forwarded to the Pandemic Response Accountability Committee. So talking about the user-defined categories, there were a number of errors that we identified. And so we want to just walk through a few of those examples, as well as talk about some changes we've incorporated into our FAQs. So first, really the user-defined categories should be the exception, not the rule. So we would expect, and certainly based on the preliminary reporting, that any dollars carried there are going to be extremely rare. So those fields should only be defined if it is not already in one of the previous A through Q defined categories based on the federal description. And we'd like people to adjust that during cycle 2 reporting. So let me walk through a few examples from cycle 1. First, in the public health category, here is a list of bullets, some of it wordsmithed a bit to kind of help it be user-friendly in terms of what should really be in what we call category L, or public health. So changes to city procedures that might have been necessary related to COVID, any types of cleaning or supplies, et cetera, that prevent the spread, of COVID, emergency operations support, any upgrades to public facilities and or closures of those facilities, particularly if it's for preventative activities to stop the spread. So it could be touchless door sensors, it could be touchless faucets in restrooms, plexiglass barriers, all of those things are covered. I do want to flag that the FMLA, or the emergency paid sick leave, emergency paid family leave, family medical leave, are all costs that would fall under public health. This is a specific question that we posed to the OIG when we saw their initial categorizations, and this is the field that they directed us to capture those types of costs and expenditures. Attorneys also, depending on the work that they're performing, could likely be very directly related to public health. In this example here, first bullet on the right-hand side, an attorney that had to create, helped create public ordinances relative to COVID would go into this category. A few other categories where the user-defined expense really belongs in one of the predefined A through Q examples include overtime related to people that were not considered public safety employees. So they would be really other staff substantially dedicated to COVID. They may only be substantially dedicated during that time in which they're working overtime. But it still would be, those hours could be and should be reported under category B. The acquisition of shelters, hotels, temporary shelters for individuals, specifically for homeless, would fall under housing support. Alternate care sites, so to the extent that there was medical surge care sites on public properties, those would be falling under medical. Emergency response, public safety, that really is your public health and public safety staff, so that goes in category L. Masks and other personal protective equipment really fall under category M, PPE, so that is a little more extensive than just masks. There were a couple categorizations that were a little too vague. So if a user-defined category is used, it needs to be a little more specific or a little more prescriptive about what exactly is happening there. So facilities management on the surface, based on the description, it's unclear that it would have fallen under the category of, under a particular category. And so we would want more information about that before we put it here, and we probably would want a little more specificity in the description, as would the Treasury OIG. Food for employees. To the extent that you're just purchasing food for individuals to, you know, in lieu of them going out to eat during their lunch breaks, it's probably not authorized. But if it's the people that have to man the SOC and you're bringing in food, or you have to pay for food as part of an overtime meal allowance related to COVID response, those could be claimed under the coronavirus relief funds. Mileage, again, is going to depend on how that mileage is incurred. Special department expense is too vague. Other is also too vague. My personal favorite in the reporting was the category none, for which they proceeded to have dollars associated with none. That also does not work. Not allowed, and very clear in recent federal guidance, are indirect costs. And FEMA match, not to be confused, it absolutely is an allowable use of coronavirus relief funds should the activity be an eligible FEMA activity as well as CRF. However, it cannot be put in under user-defined categories. It must be detailed in one of the categories A through Q. So to the extent that you're using it for a match, the 25% share needs to be detailed in one of the categories. A couple things that clearly could belong in user-defined categories is attorney. We already talked about it's going to be dependent on the activity, but if it's still reported in kind of a generic way, then it could be in user defined. The same thing for crisis counseling, behavioral health, and mental health services. Again, in some instances, that was recorded under medical. It really is about a definitional issue. It's not specifically called out in any of the federal guidance, so putting it here is totally appropriate and is a reasonable COVID-related expense. We have also heard from a number of cities, and I believe we had 237 cities on this first process report that their funds were fully spent. So do you have to continue to report? So if they were fully spent, not a combination of spent and obligated, but fully spent, so no remaining obligations, we are asking that everybody report for one additional cycle. This kind of helps us lock down and re-verify that yes, in fact, the funds were spent, that there's no remaining expenditures pending, and the categories for which the expenditures were reported in were appropriate. If for any reason a change in expenditures occurs after kind of that second report of fully spent, they obviously need to resume reporting and then report for at least 2 additional cycles, one to correct the expenditures and one to kind of reconfirm those expenditures based on the prior cycle's reporting. In terms of monitoring, oversight, and audits, so we've talked a bit about the funds being subject to the Single Audit Act. That has not changed. These funds are also subject to particular sections of uniform guidance, and we cover this on our FAQs. Finance will also begin a monitoring process in November to look at those reported expenditures in cycle 1 and cycle 2. We will do some random sampling, and then given current social distancing rules and travel restrictions at the state level, we will likely leverage technology such as a Zoom session in which you can share screens or data and information for our review related to how you've classified expenditures, how you might be tracking those expenditures in your system, et cetera. And then we are also asking that any subrecipients share with us any summary of findings from either a single audit and another audit performed at the local level related to state-directed coronavirus relief funds. That would include any kind of audit that might happen as a result of the Treasury OIG. So we're asking that those get shared with the Department of Finance. Just to recap real quick, records have to be retained for 5 years after the final payment is made, and it has to be available upon request for any of these monitoring and auditing purposes. And then this provides a list of a number of the types of identifications that the OIG has already identified related to audit purposes. So with that, I'm going to turn it over to Audrey for a bit of a demo of the web portal itself and to highlight some of the changes that have occurred since we opened up or since the last reporting cycle.
Thank you. So, Kristen, there were a few questions in there. You guys
okay.
Echo?
No echo.
Okay, just on my end then, great. So yeah, there's a few questions I left in there for you that I was not at least 95% sure on the answer. So if you guys, you wanna go ahead and take a look at that while I am doing this, that'd be great.
Okay.
Okay, so when you log in through the portal, you will come to your home screen. So you will basically see the report that you submitted last time, and it will be now switched to in progress. So you just go to the edit button and it'll bring you right back into the report you were familiar with. So a couple things about DUNS and addresses. I know there were a number of cities where the DUNS, was not working in Grant Solutions. I know there's some cases where, the city may have been working on registering that DUNS in SAM, but came up against hurdles, which I understand. I've been down that path. So if you do not have a DUNS that's registered in SAM, or if we've talked to you, reached out to you about that, we will need you to make sure you get your address information in here. And we have a new portion here for zip code +4. The OIG is requiring that +4. So if you can make sure to populate that +4 number for us, that would be greatly appreciated. And then for the DUNS numbers, I know several of the cities have DUNS numbers that begin with a 0. Sometimes it begins with 2 zeros. Unfortunately, we were not able to kind of fix that issue in the portal. However, if you do have that issue, I know we've sort of individually reached out to many of you, but we have a new field here. We have not a new field, sorry, it's an old field. This was the field that you used to describe your non-duplication of efforts and collaboration efforts. You can also sort of use that field to provide any additional comments that you would like to provide here. So for example, this might be a good place for you to say what your actual DUNS number is, since our system won't accept your leading zeros. You could also use this information to provide more detail about what your city's expenditure plan is through the end of the year, any kind of sort of information that you want to kind of supplement what information is provided through the portal. A couple things to check here is your allocation amount. This is the total allocation amount that is and has always been posted on Finance's website. So just to make sure that that amount matches what's on our website. And then this reporting cycle here will already be set on cycle 2, so you shouldn't need to make any changes there. All of the allocations to cities are advanced transfers. And the date of the transfer is 7/31. So moving on to the part C, this is different than what you had before. So most notably, we are no longer asking information regarding your projections. That was specifically information we were asking to comply with Control Section 11.90 of the Budget Act. And, you know, had to make sure with, and we use that information to send out the surveys. So not all cities got surveys, a subsection of cities got surveys, and we basically kind of use that information about projections to follow up with you just to make sure that all the funds are going to be spent within before 12/30. So what you're going to see in this first column is the expenditures that your city reported in the previous cycle. And as we sort of move forward in future cycles, this column is going to total all those previously reported expenditures. So it's going to be a roll up of everything that you reported on expenditures. It's going to be locked, so you can't change it. However, you can make adjustments to those expenditures in this next column, right? So if you decide you don't want to split out your expenditures in, you know, a bunch of different categories, you could adjust them here. Sometimes I heard from a few cities and counties that there was a division that didn't report expenditures for the first reporting period. This would be where you would sort of report those expenditures you weren't able to get in for the first cycle. We're going to have this column for all of our future reporting periods. So you'll always be able to have this opportunity to kind of go back and adjust those previously reported expenditures. This third column here is where you report the expenditures that fell in between July 1st and 9/30. So just during that period, any expenditures that were accrued is where you list those. And this total cumulative expenditures column totals everything. So it totals all of your prior reported expenditures, your adjustments, and your new expenditures. So this final column is going to be the total amount you have spent of your CRF funds. And you'll see your subtotal here. So this will be your total CRF expenditures from the state's allocation. And then we no longer need detail on obligations. We weren't sure when we first designed our portal, but OIG has now clarified that they don't need detail on obligations. They just need one lump sum amount. So this is where you would put any obligations, any contractual or say grants, award obligations you have as of 9/30 20. So if there were anything in a contract before that date and it's been liquidated, it reflects as expenditures. So this is any outstanding kind of contractual obligations you still have out there. Similar to last time, your obligations and your expenditures, sum to sort of give this total amount. In this case, it's 1 million. And that dollar amount will not be able to exceed your max spend amount, similar to the way it did last time. So I'm actually going to switch to a city that's had some expenditures that are going to need to be moved. So don't worry, I am in a test environment. So if you are recognizing the numbers from your city, don't worry, I'm not messing with your report. This is just in a test environment. But I just wanted to show you how you would actually move expenditures. So in this case, they had some expenditures in the user-defined categories that we basically are determining that would be a public health expenditure. So public outreach, virtual city town hall, this was really about informing the public about COVID, about maybe public safety measures or public health measures that are being taken, and really sort of doing that public information and outreach. So that really belongs as a public health expenditure. So basically you would just minus out the expense here. Save and refresh. So that then is going to become a 0 over here for that category. And then you go back to the other main screen and you move the positive over here to a public health expenditure. 59350, and you save and refresh. And then that sums over here and updates your total in public health expenditures. You can make other kinds of adjustments, right? If you wanted to decide that you just wanted to put everything in payroll for public health and safety, you could negative out all of these if you chose to and put one positive amount here. So basically, you are not locked into sort of whatever you report. We have several cycles, future cycles to report on CRF. So if your city needs to make changes to the way it had previously thought it was going to spend CRF, but now, things have changed. You've made new decisions. You will have this opportunity and future opportunities to reflect those changes. Kristen, were there additional questions that came in about that would be good for me to screen share and talk about?
You're talking about the particular, making that adjustment?
Anything in the portal where I should pop back open my screen share and talk through it?
No, I don't think so, but there are a couple things I'd like to clear up. And I have not gotten through all of them. There's a number of questions. So I will try to hit a couple high points. And then if there's some others that you guys want to specifically have us cover, let us know. So there was one question about FMLA benefits and whether that could include pension, et cetera. And I think there might be confusion. So for public health and public safety staff, there is a description of what's allowable, which does include benefits. The emergency family medical leave and emergency paid sick leave tied to COVID had specific rules that Department of Labor issued. And in that instance, there's a very limited number of kind of salary driven benefits that can be claimed for at least 50% reimbursement. So just want to clarify that there's different rules depending on the particular program, but you can use your coronavirus relief funds to cover a share of those costs, just not pensions related to those based on the DOL guidance. There was also a question about documentation relative to small business grants. So all of the subrecipients, which include all of the cities, have to do some level of subrecipient monitoring, and there has to be some sort of check to validate that the money provided to a small business or an individual is necessary to respond to COVID. Now, if you broadly had business closures and they fit in that business category, that could theoretically already be that documentation for that period of time where they were unable to provide, let's say, meals or what have you for restaurants that were closed or other non-essential businesses that were closed early on. But you cannot just provide $1,000 per business without having some check of necessity. in there. We think that that would be a little bit too risky. There was also a question related to an agreement with Treasury about using the funds for Project Home Key as a portion of the local match associated with that grant program that's run by Housing and Community Development. First, it is not an issue where we've sought or pursued any kind of agreement with the Treasury. We have used the broad guidance provided around a couple of things. So certainly shelter to homeless makes it an allowable activity. It has to be necessary to respond to COVID. So you need to be able to put people into that property because of the risk of higher transmission and or to support social distancing for those that are homeless and COVID positive. That does not mean, though, that the funds can't be used for that purpose. It just has to have some other tests or examples that are used. And to the extent that a asset is retained after the pandemic is over, that's allowable so long as it is being used initially to meet the pandemic. So if it is a property that's acquired and it spends most of the time that would have been needed for social distancing, quarantine, or to prevent spread among the homeless population, and it's under renovation, probably not eligible. In fact, not eligible, I should say. So it really is about how those properties are used and kind of meeting that purpose. Also, I don't know what the ongoing commitments are relative to the Home Key program. So that's something that would need to be also checked because all of these funds are time limited funds. I see a similar note related to the kind of the idea of economic support for rental assistance. Certainly using a nonprofit to help do some of that screening is allowable and eligible. Simply transferring the funds to that nonprofit by December 30th is not considered an obligation that's been incurred prior to December 30th because the funds actually have to be put to work and the benefit or the cost has to actually be incurred during that period of time, not sometime in January or February or later date. So I think that's kind of an area where you need to be thinking about that before you just move the funds to another entity. Simply moving them does not protect them from being returned to the U.S. Treasury. Are there other questions, Audrey or Nick?
There were questions about the small business program. I'm sorry, I wasn't listening very closely because I was typing answers. But I know there were several kind of along the lines of that. Do we need to prove that the small businesses spent the money prior to 12/30?
So you don't necessarily need to prove that they spent it prior to 12/30, but there needs to be some process by which you determine that they had a need. And in most cases, it could be, maybe you gave them funds based on their application to buy thermometers and hand sanitizers and PPE and plexiglass dividers, those types of things. I think based on that, that should be able to demonstrate that it was a cost incurred by that business that's allowable or eligible. It can't, though, be just, as I said, a flat amount that goes without some sort of process or assessment of need kind of in your disbursement process.
We had a couple of folks ask about, they see in your presentation that there's reporting cycles over the next year. So they're just kind of wondering why those are there and whether or not, they'll have to continue reporting beyond 12/30/2020.
Yeah, so they're there under the under kind of federal guidance, and I think the outcry from many state and local entities that it takes some time for us to close our accounting records and our books, and so some things like cost allocation of salaries might be happening at a later date. I think in general, the federal government expects that most costs will have been paid. So not only incurred by December 30th, but paid within the next 90-day period. So that's why there's some subsequent reporting cycles. There's also the option and the opportunity to shift things around. And so you may have reported funds as spent, but once you finalize records or you do some of the QC or review, you determine that one activity or cost was not eligible, you can swap it for a different activity or cost. And so a little bit of that could be happening beyond the January cycle. In general, I think we generally assume that most will be done reporting after a couple of cycles. So fairly early on, we had 237 cities report in the first process that their funds had been expended or obligated by June 30th. To the extent that it's all moved into the spent category, we only expect one additional report after that occurs in our timeline. So it's gonna kind of be city by city, case by case. If we end up with significant supply chain interruptions again, for instance, and part of the plan was ordering PPE, that order happened in October, but PPE didn't show up until next April, then that could then be reported in the subsequent cycle. So it's going to kind of depend. I think we expect most will be fully reported probably by cycle 4.
Mm-hmm. Yeah, there's a couple, seems to be a number of questions around, just to clarify. So cities need to, of course, have documentation, have a process for identifying needs, especially if they're working with a nonprofit to provide a variety of services. Essentially, have to demonstrate that it's obligated by the end of this year, correct? And some of those services will trickle through the end, through into the 2021, or is that, for example, we have a question from a city saying they provided assistance to a nonprofit to provide small business support. Does the business have to spend it by 12/30, or they have to make sure that it's obligated and it's going to have a plan to spend that over the next few months? Can we just sort of parse that out?
Yeah, I think to the extent possible, spent doesn't necessarily mean that it's been dispersed. So there has to be a legitimate activity or good that's kind of conferred between now and December 30th. And so I would hesitate to say that as long as you got it out the door by December 30th, that would pass that test of incurred or received. If you allocated, let's say, to a small business, you had a program that allocated to a small business as of November based on their need, and those funds got dispersed in December, and then they reported back to you through your process that, oh, I only needed, $400, but you gave me $500. I think you're going to have to go back in and make an adjustment relative to that need. And you could have reported it as obligated, but it won't be really obligated or spent at the very, very end of the day. So this one's a tough one. I think the more that it can be cash out the door, the cleaner things are going to be for us in terms of that documentation. I think that's the important part. One question that's come up a lot, and there is some guidance around it, is that idea of purchasing a bunch of PPE at the end to spend down the dollars. I think I even talked about this in the prior session. Probably not a good use that could get quickly audited, because it's about being present and available to address the immediate needs. If it's not showing up until March or April, or it's not even purchased until December, it's pretty hard to kind of make that crosswalk that it's an immediate need. So I think that's kind of the rationale there. If you do the order in October and it doesn't show up, that's a different type of scenario, because you needed it, you just didn't get it. And so those types of delays from supply chain interruptions won't cause it to be disallowed. It's really about timing and kind of the idea behind principal use of being able to spend the funds.
There's a good question about loans. So a question, a lot of cities have done grants to businesses. We did loans. With that distinction, do the loans qualify for this funding? loans are allowed, but I think there's an important distinction regarding loans in that when those loans are repaid, that those are still CRF funds, right? So you then have to spend that funding on some other sort of CRF allowable purpose, or you have to return the funds to the OIG Treasury. Did I get that right, Kristen?
I'll just kind of put a fine point on that. If you do a loan and they repay it between now and December 30th, you can reinvest those funds. If the repayment timeline goes beyond December 30th, let's say you did a loan today and it was a 1-year loan, any monies that come back on those loan payments after December 1st go straight back to the US Treasury. So our general advice has been to avoid loans. We know that some were done early on. In many instances, those loans could be turned into grants. And then you're kind of safeguarded, right? Because it would have occurred before December 30th. But longer term loans that have a longer term repayment cycle basically go back to the Treasury. And that one, there's a specific FAQs around that.
There was another question that I thought was good. So we provided housing assistance to renters, homeowners. Do we have to monitor these expenses? The city did our initial screening of income eligibility and sent the money directly to the mortgage lenders / landlords.
I think that that's sufficient. The only thing that you could do as part of a subrecipient monitoring program, because in this case, the subrecipient on some level became the mortgage holder. You might want to, as part of your audit program or routine, pick a few to sample and to audit to make sure that they actually credited the amount to that person's rent, lease, mortgage. But in terms of, additional verification checks, I think it's just really part of a broader monitoring program, and it's not going to be 100% review.
Let's see. Still a lot of questions about sick leave and things for safety, public safety, and things like that. So if you just want to repeat, maybe sort of, I know you've touched on it, but sort of repeat that. Yeah,
it's a little bit confusing. So if people are earning leave like normal, all of that is countable under that public health, public safety in terms of actual expenses incurred. Or even them using normal leave. If we're talking about the emergency paid family leave or emergency sick leave that was directly tied to COVID, then the Department of Labor has been more limited in their definition of what's allowable. So it's the actual pay under that program structure, as well as some very minimal salary-driven benefits. So like the OASDI taxes, Medicare taxes, that type of stuff. But pensions and other traditional benefits that you see in government programs or for government employees are not covered under that because of the federal DOL guidance, not because of the Coronavirus Relief Fund guidance. If you're talking about just normal leave for your public health and public safety staff, that's paid leave, paid time off, that is eligible under CRF. We have items on both of those in our FAQs. So I would continue to encourage both looking at our FAQs or even the Federal Treasury or the OIG FAQs. Use your Control F feature to look up and try to search for specific things that you're interested in and or things that come to mind or come up after this presentation. And then 2, we have our Coronavirus Relief Fund reporting help desk, where we field a lot of these types of questions, and we'll continue to monitor and field those questions as well.
All right, let me check in. Maybe Mallory's still having some technical difficulties.
No, I have made my computer work. My apologies all. It's 2020, so expect the unexpected. So I want to acknowledge that there was a lot of questions answered in the chat box while the DOF team was presenting. So the league will make sure to go and get that information compiled and also sent out to everyone so that you could see all the written responses that were provided, because there were a lot of good questions in there that I'm sure many cities have similar questions. So that will also be going out that we can present. Is there any other questions, Nick, Audrey, Kristen, that you feel like need to be highlighted right now?
I would just encourage people to go ahead and, first take a look at the user guide. It has been updated, kind of look through that and see if your questions are answered there. And then if they're not, then please go ahead and send us an email to that CRF email address. And we usually kind of get to those within 24 hours. So we respond pretty quickly to those.
And we can attest that you do respond pretty quickly, and always to our city officials on this call, you're also welcome to CC League staff, as you have been when you're emailing DOF. We do have a specific COVID email address, covid-19@cacities.org. We'll also work with DOF if you are sending us direct questions. So we really appreciate the partnership. I want to give DOF one opportunity for a final thought. Is there anything you want to share that is just like burning of the last thing you want to share for the day? And in anticipation, we might have more webinars with you in the future, but for this cycle coming up, anything that you would like to share?
Not particularly. I do see two questions just in a quick scan. So of the Q&A that I think we could handle pretty quickly. So one was talking about the idea to install permanent hand washing stations at community buildings or parks before December, but they don't get installed until after December. I think if you took all the steps necessary to get that started now and you do the PO, but because there's huge backlog in some of this kind of work, and it didn't get installed later, it can be recorded and reported as an obligation. It's legitimate. You had an immediate need. It just didn't happen as quickly as possible. Gets a little trickier when you move into December and you start trying to make those types of commitments. So I would suggest doing that. And there's also a question about being able to later swap something out, or if something was disallowed, could we change it during the audit? We have been told that you can swap out expenditures. That's part of why there's the cycle. So if during the audit, based on your portfolio of expenditures, they disallowed something, so long as you have other things that are kind of a backstop that are allowable, we've been told that you can swap them. That's part of the idea of this cumulative reporting that we're trying to set ourselves up for with the recent changes. And then I want to talk just a little bit more about the public health and public safety and using that as a backstop. When you have some of these programs that feel a little more questionable or a little more fuzzy, what I would really recommend, and this is what the Federal Treasury has set up for us, which is the administrative convenience of letting public health and public safety be your backstop. That means use coronavirus relief funds to kind of create some room or some space in your general purpose funding. And those funds can be spent beyond that December 30th timeframe, right? Because they've already covered what's considered a presumptively eligible cost of substantially dedicated public health or public safety staff. Once you've done that, you've met the obligation, provided it's tied to actual payroll. That gives you a little more runtime and a little bit more room to do some of these critical programs for your communities where you don't need necessarily the same kind of oversight and review at the federal or state level. So that's my plug for public health, public safety. I know in the political climate that we have today that there's some, there's broad concerns about putting what looks like a bunch of money into public safety programs areas right now. So the message that we've been giving and very consistently is that administrative convenience allows governments to bring this to the bottom line so that they can prioritize the funds that get freed up for other COVID purposes to meet their communities where they're at and be able to provide relief at that local level.
Thanks. We appreciate that information and all the efforts you have done to make sure that cities are getting information. I do want to point out that we do have, the league does have a coronavirus coronavirus website. You can find past webinars. This webinar will also be put up there once we get it rendered for the website. That website is www.cacities.org/coronavirus. We'll also make sure to go and put an email together with all this information, the reminder of contact information for DOF, and then where you can find the resources on the League's website. So again, huge thank you to the Department of Finance team. Can't say enough how much that they have talked to us at very late hours on the weekend, in weekdays, and really trying to make sure that cities are getting the dollars that are allocated to them and making sure that the reporting is done correctly. And if there was no reporting, really trying to make sure that we were able to find out what was going on. So really appreciate the efforts to ensure that these dollars are expended. So, and hopefully we get more and we can have more of these conversations shortly. Can always continue to fight for that. And that is what we are doing as the League. One last thing I do want to just point out is this week is our annual conference for the League. And we encourage you, if you have not yet registered, that you still have the opportunity to do so. The website for more information on that is www.cacities.org/events. This is a great event. It does not cost a lot. It's $50. This will give you an opportunity to get a lot of educational materials and material that will be archived that you can watch after this week. So if you don't have time this week, you can go back the next couple of weeks and catch the sessions you're really interested in. So with that, really appreciate Department of Finance's time and really, really appreciate all our city officials who are out there on the front lines addressing the needs that your cities have, the resources you need, and the League's here for you and we continue to fight for you. With that, we hope you have a really great week.
Thanks, bye.
Bye.